Good afternoon, everybody. I'm Zara Arboleta with Valley Children's Healthcare. Thanks for joining us for the latest edition of our virtual health series for families. And today we are talking about, surprise, surprise, COVID-19 and two very important issues, vaccines, as well as the variants. It's all making headlines right now. I'm joined by two of our specialists from Valley Children's. We've got Dr. Haley Nelson, who is a complex care pediatrician. Dr. Nelson, thanks for joining us today.
Hi, thanks for having me.
And we also have Dr. Laren Morgan, a pediatric cardiologist, also with Valley Children's. Dr. Morgan, thank you for your time as well.
All right, thank you. Pleasure.
So lots of questions. We've been asking families through social media to send over their questions about anything and everything having to do with COVID-19. Even though it seems like in some areas the pandemic is over and people are acting like it's over, we all here at Valley Children's know that that is certainly not the case. So for those of you who are watching right now on Facebook, please feel free to leave your comments, your questions, your concerns in the comments, and we will get to all of those questions. But a reminder, if any of you post any false information or get a little less than nice in the sandbox, we will be deleting those comments. So first off, I want to get just some general remarks from both of you. Let's start off with Dr. Morgan first. Dr. Morgan, recently Pfizer was approved to be administered to children between 12 and 15. They lowered the age just a little bit more. But then there were reports of myocarditis. There was this big thing. Everybody was hearing myocarditis. One, what is that? And two, what is the link, if any, between vaccine administration and this condition?
No, excellent question. So myocarditis involves inflammation of the heart muscle itself. Typically, patients can present with things such as chest pain or shortness of breath or even fluttering of the heart or fast heart rates. That inflammation can happen not only after, say, a vaccine, but actually can have various causes that can cause myocarditis. There were reports back in actually late May, early June about an association of young adults as well as older teenagers who had myocarditis after the second dose of the COVID-19 vaccine. As far as numbers go, the CDC as well as the FDA have been looking into these reports, and what they found is about 200 or so people have been reported through the vaccine adverse event reporting system. This reporting system is in place so that any adverse events after or in association with a vaccine can be reported so that the CDC can look into these reports. About 80 or so of those have been confirmed to be in older teenagers.
Okay, and how long were there any lasting effects for this? Is there any concern for you as a cardiologist about the long-term impacts and whether people should be wary of getting the vaccine?
Yeah. So it's obviously something that's still being actually investigated, and reports are being followed up on after patients and children who have gotten the vaccine. It is something that I think we still need to kind of look into. There's no clear yet association to the vaccine, and that's why we're still investigating it.
Okay. All right, but for you, if an adolescent is eligible and has no other contraindications for getting the vaccine, are you recommending then that children 12 and up get the vaccine?
Yes, I would recommend that children 12 and up get the vaccine. The risk associated even with myocarditis, the people who have had it typically short-lived as far as the symptoms go, and that's far outweighs the risk of actually having COVID-19 and the complications that are associated with it.
Okay, thank you so much. Dr. Nelson, want to ask you about the Delta variant. That has been all over the news, especially in the past few weeks. Do you mind giving the folks who are watching at home just a quick overview of what that is and how it may be impacting transmission rates?
Sure. So the Delta variant is just another version of COVID that is more infectious. So as there's mutations, when it mutates and it can't get people sick as fast, it then isn't going to spread. And so we see that in the unvaccinated populations where we then are still able to spread COVID, that the more infectious ones are the ones that kind of take off. And so that's really what has happened with Delta. And in the US, it was, the reports were around 50%, and now it's upwards of 80% of our cases are now this Delta variant. And certainly, I know the health department in Fresno is reporting more and more Delta cases as well. So it is here because it is very effective at its job. So a virus's job is to be able to spread from person to person. And so that's what Delta's been able to do.
And there's something I would like either of you doctors to address. We keep seeing headlines about breakthrough COVID infections among the vaccinated. Just me from the communication standpoint, it drives me a bit bonkers because we've been clear and everybody's been clear that no vaccine can protect you 100% from contracting COVID-19. However, I would love for one of you to speak to the fact that for those who are getting COVID-19 and are vaccinated, there are reports that the severity of their symptoms is greatly reduced.
Correct. The people who are getting COVID after they have been vaccinated, which can happen, you don't end up hospitalized. You don't end up severely ill. And that's one of the things that you're trying to prevent. When you look at the initial numbers before we had the vaccine of how many people were in the hospital and how many people died versus now, when you look at the numbers, the people currently in the hospital kind of on a national level, what's being reported out is that the people hospitalized with COVID are those that are not vaccinated.
Mm-hmm. Okay. So Dr. Morgan, I'm going to take advantage of the fact that this is old hat for Dr. Nelson. She's been in several of these virtual health series before, and we always love having her. But it's rare that we are able to get a pediatric cardiologist to join us. And so there have been lots of questions coming in for many of our families who are seen in Valley Children's Wilson Heart Center and treated by our pediatric cardiologist. So I would love to get to some of those right now. One question came in from a concerned parent saying, is the vaccine safe for children who have pre-existing heart conditions?
So the vaccine is safe for children that have pre-existing heart conditions. The vaccine itself, as far as the only contraindication, is for people who have severe allergic reactions, which is called anaphylaxis. Is really the only contraindication. For patients who do have pre-existing heart conditions or congenital heart disease, the risk associated, again, with COVID-19 in the absence of vaccination, not only complications of COVID-19, but also this, what we call the multisystem inflammatory syndrome in children that can be associated with COVID-19 is also a risk factor.
Someone else is asking, my 5-year-old, granted not approved yet for 5-year-olds, but this person says, my 5-year-old just had a regular physical and the doctor noticed a heart murmur. When the vaccine is approved for her age, would it be recommended for her to get the vaccine?
Yes, it would be recommended for her to get the vaccine. Her diagnosis of having a heart murmur would not preclude her from having the vaccine.
Okay. Someone else is asking, as a parent of a 14-year-old male who is healthy and a nurse myself, it is concerning getting my child the vaccine with that risk of myocarditis. Some people might just be tuning in. So if you want to just mention again, Dr. Morgan, how many people have been reported or have reported symptoms or signs of myocarditis, and what your thoughts are about that again?
Yeah. So the CDC has officially followed up on reports up to about 200 or so cases. Out of those, and that's up to the age of 30, out of those children up to the age of 18, about 80 cases or so have been reported that are still being investigated. As far as myocarditis itself, patients who have had myocarditis, some of them have exhibited symptoms most commonly of chest pain. Some of them have had EKG abnormalities that do resolve over time. And usually the most common recommendation is rest during that period of time, that acute time of myocarditis, and then following up usually with one of us as far as in the Wilson Heart Center, the pediatric cardiology.
So what are the signs and symptoms of myocarditis?
Some patients may present with chest pain, some shortness of breath. Some may feel either a fast heartbeat or an irregular heartbeat. And some may even have a fever. Obviously, after the vaccine, that's one of the more common side effects of the vaccine. But sometimes having the fever that lasts more than 24 up to 48 hours, even after the vaccine, even in association with those symptoms, would be warranted for at least contacting your primary care provider.
Good. Thank you. Dr. Nelson, you are in the Charlie Mitchell Clinic over at Valley Children's, and you're a complex care pediatrician. So you see a whole host, or you see children with a whole host and a range of conditions. What are some of the concerns you're hearing from families right now when it does come to vaccine?
There's been a variety of questions, and really trying to be proactive in talking to our parents about what have they heard in the news so that we can help kind of fill in those gaps, which is why I'm happy that we're here today and able to answer the questions that parents still have. So that myocarditis piece, and the reason why I reached out to Dr. Morgan was parents heard about that, but they didn't hear the follow-up that there were, they had the big committee meeting and there were 12 different organizations. I mean, we had not only the American Academy of Pediatrics, but the adult organizations and all the other people who sat down and evaluated that and said, it's still safe to give this vaccine. And we saw where with Johnson & Johnson, when there was that concern about blood clots, like that got put on pause, and that didn't happen for giving children the COVID vaccine. So that also tells me something about, when they really were being analytical about it, that this still is safe. And so trying to get that information out to families, and also even just telling them, that COVID can cause myocarditis, and that your chances of having bad things happen to your heart when you get a COVID infection is a lot greater than from this vaccine. And so that's really where we need to talk about kind of the resolution of that issue that hit the news, and then anything else that the parents might have, kind of heard through the grapevine, so that we can answer it.
That's interesting you say that. It reminds me to talk more about MISC. And Dr. Morgan, as a member of the cardiology team, you are one of the care team members who treat children who come in with multisystem inflammatory syndrome in children. Did I say that right? Did I get that right? MISC. And the studies have shown that children might not get COVID, but COVID exposure can lead to MISC. I would love for you to talk, because Dr. Morgan, the big selling point that people have about not getting the vaccine and not wearing masks is, well, it doesn't affect kids. It doesn't hurt them like it does adults. To a certain extent, there's some truth to that. But, tell me about some of the cases you have seen as a pediatric cardiologist for children who have been hospitalized at our very own facility with MISC.
Absolutely. So MISC, as it says, is a multisystem inflammatory syndrome of children. It can affect multiple organs, body organ systems, and the heart being included in that. Usually what we've seen as far as many of the patients who have been admitted to Valley Children's are that they had symptoms of COVID, but may not have been tested. But family members may have been COVID positive. Later down the line, 6 to 8 weeks or so, then those children develop the symptoms of MISC, fevers, fatigue, and then come into the hospital and get evaluated, and actually are found may not be actually COVID-19 positive, but actually have antibodies to COVID-19. And the inflammatory process of the heart can involve patients ranging from having normal function of their heart. Some could have abnormalities of their heart rhythm. Some may have, to the most severe case, of actually decrease in their heart function, requiring our ICU and medicines to help support their heart. So it is a variable range in which MISC can present.
Some more questions coming in. One person is asking, is the vaccine approved for children who have a seizure disorder and autism?
Yeah, so if your child has a seizure disorder or autism, those are not diagnoses that mean that you can't get vaccinated. So certainly would encourage you to talk to your doctor if you have concerns. But if your child is over the age of 12, really encourage you to strongly consider this, because we're hearing about what COVID does and we can prevent it. So a lot of this is being able to prevent illness, and that's what the vaccine allows us to do. So it's a way to keep your child healthy.
Thanks, Dr. Nelson. Dr. Morgan, this one for you. What are your thoughts on giving the vaccine to a 12-year-old who falls in the 5th percentile for height and weight? So not your average size 12-year-old.
I would advocate for giving the vaccine as long as there's no other, and really the real contraindication being anaphylaxis, but I would advocate for giving the vaccine.
Either one of you, does the COVID-19 vaccine contain egg products? I know the flu shot does, which is why my 6-year-old can't receive the flu shot.
No eggs. And then that's also why, with the concern for if you're going to have an allergic reaction, that you're monitored after you get the vaccine. So you hang out for 15 minutes after your shot, you eat your snack, you scroll on your phone, and that by the time that you are leaving with the Band-Aid on your arm and your little sticker that says I got my shot, you're good to go. So we don't expect there to be kind of delayed reaction. So of the people who had a response, it was pretty quick after they got their shot. So that's why you get to hang out a little bit longer to make sure that you're safe.
Yeah, my son has a sesame seed allergy, and so he had to sit there for just because he needs an EpiPen for that. So we had to sit at the pediatrician's office for 30 minutes. So yeah, I gave him my phone, and he just played in the lobby with that until we were done.
But that's such a great parenting tip, Sarah. So I mean, telling parents like, hey, if your kid has allergies, like make sure the iPad is charged when you show up for your shot. Like,
yeah, exactly. I'm probably going to mispronounce this, so please correct me. Someone writes, my 6-year-old child has been diagnosed with premature larki.
Okay.
The larki. Is this something that might prevent her from getting vaccinated when it's available for her age group?
No, not at all. So certainly once we get that approval and they lower the age limit, that's something where your child could safely get. There have been concerns out there, and people have had questions about the reproductive system. And so premature larki, for those of you who don't know, is essentially developing breast buds. And so having those early signs of kind of precocious puberty. And so there's that concern that has been brought up multiple times, but has not been shown to be connected. So the vaccine does not impact your fertility. It does not change your menstrual cycle or do anything from that standpoint and impact your kind of endocrine system at all.
Okay, thank you. Dr. Morgan, someone asks, my child has hypoplastic left heart syndrome. Is it safe for him to get vaccinated?
Yes, it would be safe for him to get vaccinated.
Okay. I love how you're just like, yeah, it's fine. You're good.
Yes.
And also something you had mentioned before was the reporting system for adverse reactions. Do you want to explain? Because I think there's a misconception among some people that people are just getting shots and no one's monitoring anything, which is certainly far from the truth. So do you mind just telling people at home how federal health officials, the CDC, and other agencies are clearly monitoring for adverse reactions or side effects?
Oh, absolutely. So the vaccine adverse events reporting system was actually initially designed back in the 90s. And its goal was to basically, for vaccines with either they had unusual side effects, new side effects, or not expected side effects, to have some type of system in place to report those. And the managing agencies being the CDC as well as the FDA. Anyone can actually report an adverse effect through the vaccine adverse reporting system. And then these agencies actually follow up on these reports, and they go to the links of looking through medical records, contacting providers as well as the families to actually get more information about these adverse events.
Thank you. Question just came in. We're hearing rumors about the FDA deciding to wait a bit longer to approve vaccines for the younger than 12 age group. pushing a potential fall vaccine to winter or beyond. Have either of you heard anything regarding when the age might be lowered for Pfizer, or maybe when Moderna could start lowering its age?
So Pfizer and Moderna started their clinical trials about in March and have both enrolled children ages 6 months and up. For the adult vaccine studies, they only needed 2-month time frame to be able to kind of look for adverse events and monitor before they were able to turn around and start the submission process. For children, because it's dose dependent, that takes a little bit longer to figure out. Children are not little adults. So figuring out what dose a child needs for the vaccine, that's part of what's taking longer. And then they've decided that instead of that 2-month time frame, that they're actually wanting to wait 4 to 6 months. And so it does push it kind of, I was hopeful for fall, but kind of towards the winter time frame. And Pfizer is kind of our front runner right now for saying that they will have data available to submit. So it's just kind of counting down until then.
So it's a great segue into another category of questions. We received quite a few about back to school. Obviously, everybody knows we've all got school-age children in this group here. The world shut down last March. One of my kids was able to go back to in-person learning last fall. The other one not till this past spring, was only in school for like 2 months. So a lot of questions are coming in. Is it safe to send your kids back to school this fall, especially for those who aren't even eligible for the vaccine? I know it's a somewhat loaded question, but I think people are looking to you two as experts in this field to give some advice for parents who might be really, really worried right now. I don't know who wants to start.
Nelson, you want to start?
Sure. I'll go for it and preface with, I'm a parent and I'm concerned too. And so when the American Academy of Pediatrics came out and said it's important to get our kids back in school, they said that with the preface of, we need the layers of protection. So for kids who aren't able to be vaccinated, that means having them wear their masks, having the schools continue to have children wash hands, social distance, all of those risk mitigating things that we can do when you combine them. So it might not always be perfect. And we know that children don't always perfectly have their mask on or remember to Purell their hands all the time. But the more we do that, the less your chances are of getting sick. And so that's really what we're looking at for return to school, is having all those layers of protection in place so that our kids can get back to school, because there's lots of benefits of being there. And we've seen that side of it too, for kids need to be in school, and that we really would like them to see their teachers and their friends, and it impacts their mental health and all these other things that have come up as a result of the pandemic. So being able to do that safely is important, and I think we can all kind of take a role in helping our kids do that.
Dr. Morgan?
Yeah, and I would add on, I completely agree with Dr. Nelson, and it's important, especially as a parent myself, with children who aren't eligible for the vaccine yet. It's really, yes, just encouraging them to do all those things for those layers of protection, and to help them understand why they're doing it. And I think children, even young children, are at times very sharp. So they understand kind of what's going on around them. So it's important to kind of explain those things, and that they have those tools available, mask and being appropriately hand sanitizing and things like that.
Speaking of masks, someone just wrote in, I keep hearing that wearing masks all day for children is not safe, especially during recess. Is there any truth to that? You're both shaking your heads.
Doctors, we wear masks all day at the hospital. If you went to surgery, the surgeon would be wearing a mask all day, and yet, they're able to perform. And there's lots of studies out there showing, people wearing the little pulse ox thing on their finger, that you don't lose oxygen, that wearing a mask is not going to hurt you, but it can help you by helping you stay healthy. So.
Okay. Someone asks, my 14-year-old son has mitral valve problems. Any advice for him as far as, is it safe for him to get the vaccine, Dr. Morgan?
Yes, if he's in the eligible group to get the vaccine, it would be safer for him to get the vaccine. When we think about the mitral valve issues, and again, not knowing the actual complexity or the specific diagnosis with the mitral valve, usually with any child who has congenital heart disease or an abnormality of the heart, it would be appropriate to have the vaccine.
Okay, thank you. Dr. Morgan, what is the mortality rate among children and babies under age 18 from COVID-19?
So the mortality rate is actually very, 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 very low. When we look at, and there's been several studies, and this is both in the United States as well as abroad in other countries that have looked at what the mortality rate are for people under the age of 18. And when you look at the total population of people is in the United States, when you look at mortality secondary to COVID-19 versus mortality from everything else, the mortality rate of COVID-19 is less than 1%, especially for children less than 5 years of age. When children are less than 14 years of age, that can be within 0.5% to a little bit closer to 1.5%, which is still very, 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 very low.
I do remember early on in the pandemic, though, there were studies that showed that the super spreaders of COVID-19 were COVID positive kids between, I think it was like 10 and 19 years old. And so at the time, we had our infectious disease specialists on, and they said, okay, maybe your kid doesn't get sick from COVID-19, but your kid is spreading it. And so that was another important pro to wearing masks. And there are a couple questions coming in from parents who are saying, but what if my kid has asthma? Is it okay for my child to wear masks all day while they're at school?
Yes,
Dr. Nelson?
So certainly it is safe to wear a mask if your child has asthma. The only time where it is not safe for your child to wear a mask is if they are under the age of 2, or if they have a condition in which they are not able to apply and remove their mask on their own. So if your child is severely developmentally delayed and not able to self-do their mask, then that's where that can pose a risk. But for everyone else, masks really are safe. And again, for someone with asthma, so viruses can trigger asthma exacerbations. So we see that in the winter when children, they catch a cold and then their asthma flares. And so we know that viruses can really set things off and make things worse. COVID is a virus, and that can have an impact. So if your child has asthma and gets COVID, you might be set up for a flare and worse kind of symptoms in terms of their cough and things like that. So trying to support your child. So again, the mask is safe for them.
Here's a question. Maybe I'll toss this one to you, Dr. Morgan. If a child is infected with COVID-19, are they then immune either to getting it again or to other variants?
So once you have any virus, but specifically speak about COVID-19, you can get antibodies from that infection. Those do wane over time, which is why it's important to get vaccinated. As far as patients who and children who actually have antibodies in relation to variants, variants have the ability to, for lack of better terms, evade the immune system. So the goal is to make sure that we are protected as best as possible. Right now, the vaccine is the best opportunity. So viruses and variants can change over time, and that's why it's important for us to try to keep the numbers of COVID-19 down.
Speaking of antibodies, Dr. Nelson, we've gotten a few questions from nursing moms who've been vaccinated. Are they passing along any antibodies or any protection to their newborns when nursing?
They are. So breastfeeding mommies are passing on their immune system, so they're helping protect their babies. So if they are vaccinated, that is shared with them. If you are a breastfeeding mom and you have not yet been vaccinated because you were worried about the impact on your child, I have a friend who actually did the study for that one to show that breastfeeding moms, once they got the vaccine, they studied the babies afterwards to see if they had any effects whatsoever, and none were seen. So the baby wasn't more fussy because mom was vaccinated. The baby didn't have poor sleep. There were no changes in the babies reported when they studied a large number of breastfeeding women, but they were able to then see that there are antibodies in the breast milk being passed on to that baby to help protect it.
When it comes to reported side effects, are you noticing that now that the age has been lowered for several months now, but are you seeing the incidences of side effects higher, the same, or lower among younger aged patients than older ones? Because that seems to be that's a question a lot of parents have, because I'll tell you, I got Moderna. And after the second shot, I got nailed. I was down for the count for about 36 hours. And then I woke up on that second day and I was fine. It was like a switch just went off. But my son had 13 years old, no effects at all. So I've been hearing anecdotally that kids seem to be handling it a bit better. So I don't know what you've heard or seen.
I think kids are pretty tough. So my patients have done really well. And I've, for some of them, we've talked beforehand. So I know that they got their vaccine. And for other ones, they're coming in for a different reason. And then I check the chart and I'm like, oh, wow, you already got your vaccine, and give them a high five. So I haven't heard kids who have really had a hard time. When I got mine, same as you, like that second dose, I did not feel well, but it was short-lived. And so in planning ahead for, if your child doesn't feel good, you've got, the tools on hand. So making sure you've got either your ibuprofen or your Tylenol, maybe pick a movie that they can watch, and just know that, like, hey, just let them have some couch potato time, and then it's going to get better.
And Dr. Morgan, you're treating children with heart conditions. For your patients who have received the vaccine, what have you seen as far as how it has affected them?
I would say it's very similar to adults who have had the vaccine. So the main complaint that they've said is that they've had arm pain for about a day. Some of them have had fever, not felt well. But usually after that first 24 to 48 hours, they're usually back to normal.
Okay. Someone asked this question through social media. Is it true that we got the COVID-19 vaccine for no reason?
We got the COVID-19 vaccine for a very good reason. COVID has killed numerous individuals. It has caused serious, complications. So the COVID long haulers and brain fog and all the other things that happen, that those are now vaccine preventable. So we can prevent having to deal with any of that. And for children, that the new studies are coming out that, there's long haulers for kids, and that the neurologic complications from this virus, there are actually more and more reports of that too. So there is very good reason why the vaccine is offered, and we can see where it's been very effective for those who have received it.
Dr. Morgan, there's a lot of vaccine hesitancy, and one of the main things people like to say about not getting it is that they're saying, well, this is new. This is experimental. I'd love for you to speak on the fact that the technology is not new, and no, this is not an experimental drug.
Yes, these drugs, these vaccines have gone through clinical trials, and those are the opportunities to identify periods of time where there are any adverse effects, and also look over a large population of people to actually see if there's any adverse effects during the clinical trials. So it isn't an experimental medication or vaccine that's given. It actually was authorized by the FDA. It was given an emergency use authorization. With that being said, the vaccine itself, when people get either the 2 doses, or for people who are eligible to get the Johnson & Johnson vaccine, which is 1 dose, I think it's important for them to remember that you have to have 2 doses for it to be effective. And it has to be after a certain period of time. So that certain period of time is 2 weeks after the second dose, or if it's the 1 dose, 2 weeks after the 1 dose with Johnson & Johnson. Any time within that time, you are susceptible to get infected with COVID, potentially.
Someone sent a question in earlier today saying that they received Johnson & Johnson, the one dose. Johnson & Johnson has been shown to be slightly less effective at protecting against the Delta variant than Pfizer or Moderna. And they were asking, well, then is it okay for me to either get a second Johnson & Johnson dose or one of the other vaccines? Can one of you speak to, because there are people like, well, just give me all 3 then. But that's not really supposed to be doing that yet.
We're not supposed to be doing that yet. But it's being studied for looking at booster shots, looking at, do we mix? So if you got a Pfizer and a Moderna, does that somehow protect you better than 2 Pfizers? And so people are looking into that, but there are no recommendations yet to run out for switching vaccine, getting another one, or, doubling up or anything like that just yet.
I'd love for either of you to speak to the fact that in parts of the South right now, they're already seeing cases of flu and RSV. Luckily, at Valley Children's this past winter, I think our flu, I can't remember the exact number, but when I had checked with our emergency department, the positivity rate for flu cases was astronomically low. It was like 0.18%. So obviously, social distancing and masking worked to keep our kids from spreading germs. We all know our kids can be petri dishes of germs. Any concerns and worries about what this winter's flu and RSV season might look like in the absence of masks in public places and everybody returning to regular activities? I don't know who wants to take that one.
I'm like, Dr. Morgan, do you want it? I'll go.
Do you want me to go, Dr. Nelson?
Go for it, and then I'll chime in.
Okay. So, so children will be back together amongst each other, where majority of them haven't been doing next to each other for an entire year. So, with that being said, and I think we've started to see that a little bit with children who start to go back into daycare, automatically getting sick, and I think that's the same possibility that could happen this fall. Again, you'll be exposed to each other. Again, all wearing masks, but still in the same vicinity and still indoors. So I do think there is that potential to see RSV and flu kind of stick to a more usual trend that we've seen in the past. As far as I think another question people have asked about COVID-19, I think right now, one of the questions that I've had in the clinic is, what's the trends of COVID-19 right now with the variants, especially going to the summertime, people being more out. And really the trend here kind of in the Valley Children's, just to give perspective, has been fairly low percentages, usually between 2 to 7%. And for perspective, at the peak of the pandemic, we were looking at positivity rates that were close to 20%.
Okay. Dr. Nelson?
I think to chime in too, there's kind of a pediatricians talking about it being Christmas in July. And what that means is that the winter cold and flus are hitting in the summer. And that's really what you had initially asked for, RSV and some of these other things that are coming out that we don't typically see in July. And even in the hospital, children coming in with croup. Like, croup is not a diagnosis that pediatricians typically see in July. And yet we're seeing it. And that's because restrictions are lightening up. People are interacting again. And it's nice to see people. So we're not saying, like, don't see anyone, but it is something where if you have an unvaccinated child or you yourself are not vaccinated and you're in a large group setting, there's a risk of getting COVID or getting something else. And then you have to go through that whole process of staying home from school and from work, and kind of what a pain it turns into, in addition to worrying about your child's health.
And Dr. Nelson, that reminds me of something that you really stressed for parents when school started reopening was have plans in place if your child is not feeling well, because gone are the days when you load them up with a little Tylenol and pray that their fever goes out so you can send them back. Like, we all have to start thinking of other people now, a lot more. I should say.
We do. Like, please think of others and keep your child at home. Like, if they don't feel good, they don't want to be in school anyways, and we don't want them spreading their germs. But that really does impact, the number of days that they're going to miss school, because the schools are paying attention and the school doesn't want them there sick. So, don't be surprised when the school nurse calls and says, your child's coughing or your child threw up once and they have to go home, because that's what they need to do to protect all the other children. Unfortunately, then you're home with them. So whether or not you can work remotely or how you kind of sort out your childcare, it can be tricky. And that's going to be a challenge for a lot of working families as we head back into school of what do we do and what are my contingency plans for for kind of handling the inevitable illnesses that our children might get.
Yeah, and it should point out too, some school districts are requiring that if one child is going home sick, even if you have other children at other campuses, you have to take them all home. That happened to me. I had to pick up kids from 2 different campuses, and I'm all, but it's just allergies. And they said, sorry, you got to get both kids. You got to get COVID tests. That's just pretty much, I hate the term the new normal, but it really is.
Right.
We're getting a few. What's that? Sorry, Dr.
I was just going to chime in too, that it's really hard because in kids that it can seem like just allergies. And I've had parents tell me, oh, it's just allergies. And we do the COVID test anyways. And guess what? Their kid had COVID. So you can't tell because children sometimes have such a mild illness. Although again, we heard from Dr. Morgan about MIS-C and the other things that can come later on. So that's why we, harp on wanting to prevent it, because of we see these complications, but that kids can be pretty mild. And so we don't know. And a lot of times, it's really, it feels like it's COVID until proven otherwise. And we're doing a lot of testing because that's how we're going to know and then be able to give you the best advice for how long you have to stay home with your child.
We're getting a few questions coming in about immunization. So not COVID-19 vaccinations, but your regular good old annual shots that you're supposed to get. We saw among Valley Children's primary care practices, and we also saw this trend nationwide, that so many children have fallen behind on their regular immunizations for things like measles, mumps, rubella, chickenpox, all of that stuff. I'd love for both of you to talk about, because someone said, my child isn't around anyone else. Is it okay if they're behind on their shots? But I already know what you're going to say, Dr. Nelson. But we are seeing, I know Fresno Unified has done stories on this, Kern County. They've been saying so many kids are behind on their wellness exams. Speak to why that is so important to get back into your doctor's office, Dr. Nelson. Let's start with you.
It is so important to get back in because the last thing we need during this pandemic is to start another one. So we don't need a measles outbreak. We don't need those things. But there's, so in addition to getting your child their vaccine, so really making sure that they're up to date. So our offices are open, like call your friendly pediatrician, get your appointment. Like it's time to get caught up on his wellness checks because there's more than just shots that pediatricians do. And we're just checking your child's height and weight and looking to see how they're growing, screening your adolescent for depression and seeing how they've been coping during the pandemic. I mean, there's checking their vision, their hearing, and the list goes on and on. There's a whole giant table that I have that's the periodicity table for the American Academy of Pediatrics that tells me all the things I'm supposed to cram into that visit to make sure that that your child's growing appropriately and has all the things that they need to be successful. And so there's lots that your doctor does at each of those wellness visits, and we'd love to see your children back. So really just encouraging families to call and make those appointments.
And Dr. Morgan, it's obviously important for kids to have all their immunizations when they're supposed to, but for the population you see specifically, it seems in some ways it's even more important that the kids you are seeing at the Heart Center, that they're coming in for their regular checkups as well.
Absolutely, yes, and they should be caught up on their regular immunizations, but yes, outside of that, they're chronic conditions. So patients with heart conditions, patients with asthma, patients with diabetes. Those were where appointments were delayed because of the pandemic. It's really important for them to get right back in to have those appointments and resume their care.
Dr. Morgan, what do you want to say to parents who have children with very complex conditions, and these parents are just simply too scared to even leave their house and come to the hospital, to one of our specialty care centers? What do you want to say to those moms and dads about the safety precautions that are in place, for instance, at the Heart Center?
Absolutely. So when you enter into the hospital, first of all, you're screened. And when you come into the Heart Center, you typically ask questions as far as your state of health. And then as far as screening, we have masks available for people if they don't have a mask. We have plenty of hand sanitizer that's available. We try to limit the amount of people that are within the exam rooms during a period of time. So usually once they get checked in, they're usually escorted back to their patient room. And then we typically do the testing that's necessary at that period of time. during that visit, so that they don't have to come back for excessive visits to get tests done, such as echocardiograms and other diagnostic testing.
Okay, thank you. And want to remind parents at home too, if any of us even so much as sniffles at the hospital, we get swabbed. We get tested.
Yes.
I do want to point out to those who are watching at home, we have not had a single case of COVID-19 transmission between a workforce member, so either a physician or a staff member, to a patient, and vice versa, and to each other at any of our facilities. Our infectious disease team has been key in enacting policies and procedures that not only keep patients and families safe, but each other as well. Here's one for you, Dr. Morgan. Someone writes, my 3-year-old son is a Valley Children's Heart Warrior. Oh, I love it. I love it when we see those. We always locked down in quarantine during flu season, and now obviously with the pandemic. But now this family has a 10-year-old who's getting ready to go back to school, exposed to a lot of other kids, exposed to people who don't believe there's even a pandemic. So what advice do you have, Dr. Morgan, for this family to prevent their heart child from getting exposed?
All right, my lights went out here.
Oh, you're not moving enough.
Motion.
There you go. There you go.
So, and this is a common question that comes, especially when there are children who are either older, or even children who are older and eligible for the vaccine, have gotten the vaccine, who are going back to school, versus children who are either staying at home or not eligible for the vaccine. Mm-hmm. So what I typically recommend for parents is kind of the same things that we've kind of already reiterated a little bit, especially for the child who's going to school, making sure they're doing all those appropriate things, such as wearing their mask, hand sanitizing, and really focusing on those layers of protection. For the child who's at home, I think that's important for those people to really protect that child too. Yes, there's instances where they may go to daycare, and also those protections should also be in place at those facilities as well. But really, we have to then protect the child who's not vaccinated. So we all have to do our part to make sure that that's the case.
Thank you, Dr. Nelson. That's something you've been beating the drum on for a long time, that there are so many kids who can't get vaccinated, which is why it's so important for the big people around them to get vaccinated.
Pretty much. I mean, that's how we can protect our vulnerable patients. And so whether your child goes to the Heart Center, or if they go to any of our specialty clinics, or come here to Charlie Mitchell Clinic and go to a lot of the specialty clinics, we know that you might be concerned that your child's at increased risk, and communicating with the sibling that's going to school and kind of making sure that they're on the team for why we're being so strict about that they wear their masks, because of how they're trying to protect their younger sibling. And so kind of having that conversation as a family can also be helpful to just kind of drive it home, and that a lot of these families have really done well this last year because they were used to staying home. And so this is the next part where it's anxiety provoking to consider getting back out there, because they've done so well, and that we've all been protected. And now how do we enter kind of the world again and do that safely?
All right. We actually got to everybody's questions. I'm so excited. And if we don't get to people's questions, if someone has a last minute question, feel free to leave those in the comments and we'll get the answers to those later. Before we leave, Dr. Nelson, Dr. Morgan, any final thoughts for the folks who are watching this, or who might be watching it later today? Dr. Nelson, why don't we start with you?
I think if you still have questions after watching this, like, first, thanks for watching, but then there's resources to go to. So really knowing where those trusted resources are. And one of my favorites is healthychildren.org, because that is the website from the American Academy of Pediatrics. So I know that it is written by trusted pediatricians to be able to give you the advice that you need. And they've covered a variety of these topics that we've been talking about today. So
great. Thank you so much, Dr. Nelson. Dr. Morgan.
Yes, I would completely agree with Dr. Nelson. I think it's important, if there's any questions that you have, feel free to ask, your primary care provider. If you see a specialist, feel free to ask your specialist if there's concerns, about COVID-19 or even the vaccine.
Okay, thank you so much, both of you, for. Oh, I almost forgot. We actually have a walk-in clinic at Valley Children's Hospital tomorrow. So for anyone who's in the Madera, Fresno area, everybody says it's so far. It's literally 3 miles north of the Fresno line. So if anybody's in the Fresno Madera area, if you want to come to Valley Children's Hospital tomorrow, we are administering the Pfizer vaccine. So 12 and up are eligible, barring any other conditions or contraindications. But it's from 9 a.m. to 4 p.m. at Valley Children's. Walk right in and we will get you set up. Bring your whole family 12 and up, and we'll get all of you taken care of. Your first shot would be tomorrow, and then your next shot would be 3 weeks. Your next dose would be 3 weeks later. And we were talking about resources. We do have a little graphic we want to put up for you. We have a great set of resources, including ones that Dr. Nelson mentioned on our Valley Children's website. Go to valleychildrens.org/COVID-19. And something that we still continue to operate is our COVID-19 hotline, where our actual nurses are answering your questions. So if you're in the 559, the number is super easy to remember, 353-3333. 353-3333. There's also a toll-free number there, 888-286-9336. I cannot stress to you enough how open all of our pediatric specialists are, not only Dr. Morgan and Dr. Nelson, but any of our doctors. They are willing at all times to answer any of your questions. And no, there is no microchip in the vaccine. Everybody always says that. I always tell them, if you don't want to be tracked, you better get rid of your cell phones. So, but I do thank you both for helping to guide this conversation and answer the questions and concerns of our families. And to those of you watching at home, thank you very much. We are here to answer your questions any time of day. Have a great day.